before to start this session, you have to know that every cancer is a genetic mutation. Every cancer, irrespective of its type. So let's move forward. So today we are going to discuss cancer. Prior to the genetics role of cancer, we have to know what actually the cancer is. So today we are going to know about cancer. What is cancer? How will it occur? And then a change in gene. So what the change and what that cause and what its important role in cancer. So unveiling the ways gene activity can be changed. How can be the gene can change. So next, acquired versus inherited. It is nothing but germline versus somatic mutations in cancer. And then familial cancer syndromes. Does really hereditary matters in cancer? So these are the primary aspects and basic things today we are going to discuss. And one more thing, we can't able to conclude the whole concept of cancer genetics in just a 1 hour or 1.5 hour session. So we are planning to divide it into episodes. So that's why this is the first episode of cancer genetics. We are dealing with the basics and overall significant things that we have to mention in cancer genetics. So let's move forward. So what is cancer? Cancer is just a condition where a cell division is uncontrollable. It might be due to an environmental factor or it might be due to a genetic mutation. The thing is, cancer is just an uncontrollable division of cells. No matter whatever it is, just cancer. If anybody say cancer, it just means an uncontrollable division of cells. That's it. We just locate and we just detect the cancer by the overgrowth or uncontrollable growth of cells of their location. Whether the uncontrollable growth of cells will occur in breast, then it is breast cancer. Otherwise, it occur in colon, it is colon cancer, or rectum, rectum cancer, cervical, whatever it might be. So the basic line is uncontrollable growth of cells is cancer. Based on the location, we classify the type of cancer. That's it. So the primary thing is cancer is when abnormal cells divide in an uncontrollable way. That's it. So a cluster of cells. The human body is made up of trillions of cells. We know that. Trillions of cells. The basic building blocks of any complex animal. See, our body having millions of cells which have a distinct function. Every cell has its own distinct function. These cells normally work together to form organs such as heart, liver, and skin in order for cells to work together. So our body should work together to make a certain traits and characteristic features. That's why our body cells should be divide their characteristic features and they show their individual phenotypes. That's why a cell that need to be divided into a brain cell or a liver cell or a muscle cell or a blood cell or intestinal cell, whatever it might be. That is what the primary factor. Even though we have a cluster of trillion cells, every individual cells have their individual functions. For example, they need to be able to divide to make new cells at a right time, stay where they need it. That is what the point is. Every cell must do their work according to the priority. So there is a no rush, no crowded, nothing. Every cell function is to be a patternized. That's what they are indicating. The cell is able to divide to make new cells. It might be liver or brain or muscle cells at the right time, stay where they need it. That is what on priority, and not crowd out nearby cells. Cancer begins when cells in the body become abnormal and start to grow out of control. This is caused by certain changes in the cell genes. So let's look into this. A mutation. I'll explain later on slides. The division of cells must be organized, patternized. If anything, it might an environmental factor or an internal factor that lead to mutation, then the cell division and replication will be aggressive and in uncontrollable way. That leads to form a tumor. So the place of tumor will give us the type of cancer. So the basic thing is uncontrollable division of cells is cancer, and the place and location of tumor leads to categorize the type of cancer. So additional mutations accumulate, then it leads to metastasize to nearby locations. So we'll see in next slides. So this is the actual baseline pattern of division of cells in the body. Oh, a change in the gene, right? So we call it as mutation. A mutation. We see here, right? Mutation. So what is mutation, and what is a baseline mechanism behind this mutation? Prior to that, you have to know that our body has on and off mechanism. On and off. Our body can on the type of cell or type of a protein which work is actually essential, and it can off the functioning of a protein. See, genes are pieces of DNA inside each cell. They tell the cell how to make proteins it need to function. Actually, our genes, that genes is just an instruction manual. It guide the protein to do the function, right? Our gene is kind of an instruction manual. It guide the protein to do the function. So every protein has its specific job. It might create a hormone, it might be creating an external feature, it might creating any kind of enzymes, whatever it might be. Every protein has its specific job. For example, some genes code for proteins that help to grow the cells and divide to make new cells. So in a particular manner, we need a protein to stabilize and maintain the standard division of cells. And some other genes that code for a protein, that protein guide to tell help, and some other cell need to create a cardiac muscle. It will guide the protein and make the protein into a cardiac muscle. So each cell will have the same genes, but the cell individually utilize particular genes what they want. That is what the mechanism inside the body. That is, it turns on, that means activate. It activates the genes it needs the right time and turns off the genes that it doesn't need. Sometimes, if a gene code for a protein, the protein function is already done, it work, everything what it actually needs, then it immediately turn off the gene that doesn't need anymore. Soon after the cell division, it's okay. Now cells are enough in the body. Immediately, the gene turned off. And it might not code for the protein, and the protein not going to do a phenotypic characteristics. So this is what an on and off mechanism that usually underlying in the body. So it's maintained in on priority basis. Turning on some genes and turning off others is how a cell became specialized, such as becoming a muscle cell or a bone cell. So that is what I'm said, no? So if it is a muscle cell, if it need a muscle cell, it actually code for muscle cell. That's it. It never go with bone cell. So if it is a bone cell, it never go with a muscle cell. So the muscle cells are off. So every cell has its own on and off mechanism. For example, some genes stay active all the time to make proteins needed for a basic cell functions. Other genes are shut down when their job is finished and can be turned on again later if needed. So whenever if needed, that's it. The point is on priority. If the cell decide there is a need of thing, then it asks for a gene to code a protein. So it's on basis journey of a cell division. But if the pattern if the pattern of stabilized growth and on priority basis mechanisms are changed due to a mutation, the change in the sequence of the gene which code for a protein and the protein which listen to the cell mechanisms are changed due to a change in sequence of gene that code for a aggressive protein that lead to unstable the whole mechanism and lead to unstoppable growth of cell or unstable growth of cell division. So this leads to a mutation. This leads to a whole complex process, change in the whole complex process. So alteration or change in genetic material, we call it as mutation. So what are the mutations and what are these gene variants? We are generally looking at, see, for example, we have a lot of mobile phones upcoming in the market, right? So we have variants. Suppose V10, V16 variant, X Pro 19. So there are a lot of mobile brands having different variants. Individual variants have individual RAM, GB, internal storage, camera setup, everything. So the brand is same. Suppose we see Vivo or Oppo or whatever it might be, MI. So the brand is a single brand which have different variants of phone. Individual variant of phone has individual specificity. As such, we have single gene, but it has variants. The variance is due to change in nucleotide sequence. The change in nucleotide sequence will cause it as variant because both are the same genes, but the change in the sequence of nucleotide lead to bring it as a new variant. That is what gene variant and mutation. So while we all have basically the same set of genes, even though you, me, and all over the people in the world are having same set of genes in our body, but we also have differences in our genes that make each of us unique. The differences in variation of the genes, but not in the genes. You have to understand. Everybody have TP53 gene in our body, but that TP53 might different in you and me. It's based upon the sequence. That is what everybody having same set of genes, but different in our gene variant. That is what the point is. That make you and me a different and unique. The code or blueprint for each gene is contained in chemicals called nucleotides. We everyone know that there are four nucleotide base pairs: thymine, adenine, cytosine, guanine are the baseline amino acids of the body. See, DNA is made up of four nucleotides: adenine, thymine, guanine, and cytosine, which act like the letters of an alphabet. Each gene is made up of a long chain of nucleotides, the order of which tells the cell how to make a specific protein. So this actually tells about the instruction manual, how the order of nucleotides, how the sequence of nucleotides will actually explain the proteins to do its function. So it's an instruction manual based upon the sequence of formation of nucleotides. So some people have changes in the nucleotides of a gene, which are known as variants, as I said earlier. So people have variation in the genes. For example, one nucleotide letter might be switched for another, or one or more letters might be missing when compared to the most of other people genes. Gene variants can have different effects of proteins they code for. For example, we have seen a breast cancer patient. Usually BRCA1 and 2, BRCA1, BRCA2. These are the two basic genes or familiar genes where majority of people are affected with a pathogenic variant of BRCA1 and 2 in their germline mutations. We see BRCA1 and 2 is two genes which is common in everyone, but every individual woman who got pathogenic variant of BRCA1 and 2 having a different kind of variant and different kind of nucleotide change among them. Even though if you choose two people, they have a different kind of change in different kind of sequential modification in their genes. So that is what people having genes but different variants. That different variants lead to mutations. So the concluding point is mutation is also different from person to person. So mutation is not common and not equal for everyone. Even though it is a disease, it is different for you and different for me. Even though it is the same disease, but our individual sequence change, our individual turn will make it as difference from molecular level. So that's precisely making a difference, and that precisely making change in prognosis, that precisely making change in treatment options, that precisely making change in further procedure of treatment. So that molecular change is essential to diagnosis. I think you people getting what I'm saying. So that precise change is mean to diagnosis initially to detect the whole concept of changing mutation. Some variants can lead to disease, such as cancer. Yes, as we are speaking about cancer. See, all the mutations or all the variants are not going to cause any phenotypical change or any kind of things like what we are seeing, what we're discussing about the diseases like cancer. But some mutations, some mutations which are predominantly act and predominantly focused and predominantly code for the protein that lead to cause a disease such as cancer. So increase the risk of disease that refer to a pathogenic variant. We have usually seeing the sequence of next generation sequencing. We got pathogenic variants which indicating that will cause the disease. So okay, how the cancer can rise to the people? Usually people get cancer by two ways, either through inherited mutation or an acquired mutation. Inherited mutation, the name itself indicating inherited. We inherited from my parents, from the superior generations. So the inheritance will also implication not only for the generalized disorders, or actually we are seeing in X-linked disorders or any autosomal dominant disorders. Anyway, cancer is itself an autosomal dominant disorder, but all cancers are not inherited. But every cancer is a genetic mutation. So you have to be very clear about this. Every cancer is caused due to a mutation, genetic mutation, but all cancers are not hereditary. Only some cancers are hereditary, and some cancers inherited from the parental generations, and remaining cancers, most of the cancers are sporadic. They are acquired mutations. So a cancer can rise from two ways: an inherited mutation or an acquired mutation. Inherited mutation, it's nothing but we are first getting the mutation from the baseline itself. That is, we inherited from our parents, so it present in the very first cell from the beginning, from the zygote itself. Once the egg cell is fertilized by the sperm cell, that eventually became a person. We are born out. We are coming out from a single cell now. That's why. So the whole concept of human body is just is just started with the single cell. So the mutation arises there itself. That is called inherited mutation. We have inherited from the parental generations. We usually inherit 50% of chromosomes from the mother and 50% chromosomes from the father. So we inherit the mutation where they are implicable or they are crossed with. So we inherit the mutation from the parental generations. Since all the cells in the body came from the first cell, the mutation is in every cell in the body. So if we inherited a mutation from the parents, we have every cell in the body have that mutation from childhood itself. So that is the major thing of inherited mutation, and can also be passed on to the next generation. It's not only stop with us, it can lead to the next generation and passed on to the generations to generations and showing the same phenotypical character. It might change due to the generation variation, but it can show the phenotypical implication of the mutation. So this type of mutation is called a germline mutation. Germline mutation. So it is nothing but hereditary mutation or hereditary cancers. So on the other hand, we have acquired mutations. So this acquired mutation we are not getting from our parental generations. These are not having in every cell from the childhood. So this acquired mutation is not inherited from the parent. Instead, it develops at some point during a person's life. The person may have chronic smoking habit, or the person may have UV exposure, heavy UV exposure, or a person is working under mining or asbestos factories or whatever it might be, due to epigenetic factors, environmental calamities, or everything. Everything can imply a person to change the sequence of DNA and turn it as to mutation in some point of the person's life instead of getting from the parental generations. This is called acquired mutation. So the acquired mutation occur in one cell and then to pass on to any cells that come from that cell. That is called metastasize to the cells. So these mutations cannot be passed to the next generation. That is more important. If we are treating with a cancer patient or cancer disease, we must focus on whether this is, see, the major thing, the clinicians, so as being a person who is working in a cancer setup, oncology setup, I know that majority of clinicians, they focus on the patient. If a patient comes with a disease, cancer, they explain the whole scenario. What is especially what is the cancer? If it is a breast cancer, they explain what is a breast cancer. Is it a lump or a tumor, or it is a nodal infection or whatever it might be? They do biopsy, they configure it. If it is a breast cancer, they explain them for chemotherapy or a surgery or a radiation therapy, and they conclude the session. If it is working well, they send them home. But the point is, we have to know whether this is an inherited or acquired mutation. Anyway, it is a cancer, it is a genetic mutation. It's irrespective of its type, it is a cancer, it is a genetic mutation. We have to know whether it is inherited or acquired. That is what, and that is where, as being a genetic counselors and medical geneticists, who has a prominent role to diagnose and to verify through doing pedigree. So we have to assess the family history, whether the parental generations have any significant cancer history or not. That is where we stand out from the clinicians and the doctors. So this mutation cannot be passed on person to person or a generation to generation. So because it doesn't affect the sperm or egg cells. This type of mutation is called sporadic mutation or a somatic mutation. So only two things: inherited mutation and acquired mutation. So see this, somatic DNA changes acquired over a person's lifetime in a single cell. Whether the person is chronic smoker for more than 35 years, he get a lung cancer. So the lung cancer is due to millions of carcinogens he inhaled from past 30 years. So that is the only factor which changed the sequence of his gene, and it leads to a mutation that causes lung cancer. So that is somatic change that only applicable to that person, that cannot be inherited to the next generations. In other hand, we have a germline DNA changes that present in every cell of the body, including egg and sperm. So if you inherited that germline mutation from your parental generations, then you have every cell, you have the mutation in every cell of the body, even in your egg or sperm. So you can increase the cancer susceptibility to pass that to your next generations. So that is where we have to stop the germline by detecting, yes, this is germline mutation. They have a familial history. So soon after the marriage, you have to go with IVF, pre-genetic implantation, PDG, pre-genetic implantation diagnosis. So we have to focus on these kind of things, whether to stop the germline to next generations. That is why we have to know whether this mutation is somatic or germline. So, and we have a lot of epigenetic factors out there. It's not only about somatic mutation and germline mutation, but we have mutations which lead by the environmental factors. We have a DNA methylation. So it need it's elaborated topic. It need a pathway and a chart. I'll explain in next episodes. This is the very first initial beginning. So this is an introduction topic to epigenetic factors where a mutation can occur through a DNA methylation. As you are seeing the vector here, it's a kind of vector where a DNA is attached, a methyl group is attached to the DNA nucleotide. So this methyl group is attached to the DNA so that gene can't start the process of making the protein. So if a methyl group attached to the DNA, then the DNA will stop instructing the protein. Whenever the methyl group releases and deattaches the DNA, then the DNA start instructing the protein to code for the characteristic features. So these processes are called methylation and demethylation. So this actually happening in on and off process of the DNA. So this on and off process severely cause mutation. So DNA methylation can cause mutation. So the histone proteins can be changed by adding a small chemical group called acetyl group. We have an acetyl group as same as methyl group. We have acetyl group. Whenever the acetyl group added to the histones, then the total chromosome will be the place of chromosome. It's not the total chromosome. The particular site of chromosome will be deactivated. The part of chromosome, while taking them away, if it is the acetyl group attaches to the histone proteins, the part of chromosome will be deactivated. Whenever the acetyl protein releases from the histone protein, the acetyl chemical releases from the histone protein, then it's reactivated. So this histone acetylation can cause cancer, can cause a serious mutation. So these are two epigenetic factors that leads to cause mutation. So what are those genes? So we are seeing that why it can be happen. Okay, it might be an epigenetic factor, or it might be inherited, or it might be acquired factor. Whatever it might be, they are changing the sequence, right? What are the genes these factors are focusing on? Are there are any specialized genes that these environmental factors are completely focused to change the scenario and start uncontrollable cell growth? So we have to look what are those genes. If there are any genes are there, then what are those genes? Some genes normally help control when our cells grow and divide, make new cells, repair mistakes in DNA, or cause cells to die when they are supposed to. Our cell has a protocol called programmed cell death, apoptosis. Whenever the cell functioning is completed, then the cell will apoptosize because it can't able to store in the body, right? So it has programmed cell death ability. But if a mutation happen, there is an uncontrollable cell division is occur, then this programmed cell death functioning also stopped due to the differentiation and variation of the mutation. So there are some kind of genes are responsible for cancers. So what are those genes? Look at this. We have oncogenes and tumor suppressor genes. I'm extremely sorry, this suppressor gene. Oncogenes and tumor suppressor genes. Whenever we are coding for, whenever we look at the oncogenes, everybody having proto-oncogenes in our body. Everybody. So proto-oncogenes are the genes that normally help and protect the cell. See, the only thing every individual cell or individual gene is made to protect the body. Our own body doesn't make the genes to affect us, no. So the only thing the body make and produce the kind of genes that should protect the body. So proto-oncogenes are the super soldiers of the body, were normally designed to grow and divide to make new cells and to help cells to stay alive to do their regular pattern of function. So, but if mutation or a changes occur in this proto-oncogene, which is a super soldier of the body who deals with a programmed or a stable cell division, it vigilance the stable cell cycle. So, if the proto-oncogene mutates, there are too many copies or mutation, first mutation, second mutation, or multiple nucleotide changes in the gene, then it becomes to turn on activated to an aggressive oncogene. Then it's not supposed to be work as normal. It's not supposed to be control the growth. It's not supposed to be patronized the programmed cell death program to the cells. So whenever it turned changes and mutated, then it activated the gene activated and code for a protein to abnormal uncontrollable cell division. So look at the image. Normal gene versus mutated oncogene. It lead to aggressive abnormal cell division that leads to tumor and that leads to metastasize and leads to cancer. So that is what oncogenes, how the proto-oncogenes will change to oncogenes that lead to cancer. So there are particular see, the mutation has been happened. It might be environmental factor. It might be UV rays. It might be carcinogens or whatever it might be. The mutation happened, but the mutation focused on some kind of genes like this. So this is one of the gene, proto-oncogene. If the mutation occurs, it leads to an oncogene. And next, on the other hand, we have a tumor suppressor genes or normal genes. They are very normal genes that actually slow down the cell division. Whenever the cell growth is high, whenever the cell growth is some little unstable, then immediately tumor suppressor genes. There are genes that control, slow down. It's just like brake in the cars. Like we have a brake in car. It just push the brake clutch. So immediately the cell division has been slowed down and tell cells to die immediately. If the cells are growing faster, then immediately the apoptosis program has been initiated to every overgrowth cells. So this is the proper functioning of tumor suppressor genes. The name itself indicating if any overgrowth of cells, immediately if it should be suppress the tumor. So that is the program of the tumor suppressor genes. So the process of apoptosis or programmed cell death is initiated by tumor suppressor genes. But if this warrior has wounded, if this warrior have wounded, that means if the gene is mutated, then it turns aggressively. The gene doesn't work properly. Cells can grow out of control, which can lead to cancer. So there are certain genes which actually work for us. So the implications, the environmental factors, focusing on those genes that actually cause cancer. In focus, the tumor suppressor genes. See, tumor suppressor genes, the mutation in tumor suppressor genes may cause due to an inherited change or a somatic change, whatever it might be. They can cause any cancers in the body. It might be lymph vessels, lymph nodal, anything, or it might be due. It leads to nerve related cancers, or blood vessel related, or fat, muscle, tendons, ligaments, cartilage. So soft tissue sarcomas are predominantly caused due to tumor suppressor genes. So as we have a TP53, as we discussed earlier. So they cause certain type of cancers to run in the families. But most of tumor suppressor gene mutations are acquired during person's lifetime. It's not inherited, but it's most of time. So this tumor suppressor gene mutation can cause an inherited basis or can cause an acquired basis. It might be a germline, it might be a somatic or a sporadic. So this is change of gene. It might through inherited or it might through sporadic, whatever it might be. For example, TP53 is a gene, is an important tumor suppressor gene. It codes for P53 protein. So we have a TP53 gene that codes for P53 protein, which helps keep cell division under control. It monitors cell division. As I said, cancer is nothing but uncontrollable cell division. Anywhere, anything in the whole cancer history, the whole cancer chapter, the whole cancer oncology unit will discuss about uncontrollable cell division. We are focusing on what are the roles and what are the things that initiated this uncontrollable cell division. That is what we are studying in a large and broad spectrum. So this is where TP53 is a gene that coded a protein P53. The work of P53 is to cell division. It has to control the cell division. So the inherited changes in the TP53 gene can lead to Li-Fraumeni syndrome. Li-Fraumeni syndrome causes any cancer of the body. As I told, if TP53 mutated, as I told, the cancer can cause in lymph vessels, can cause in nerves, can cause to hematological malignancies, or can cause fat or muscle tendons, anything, a bone cancer, whatever it might be. So if TP53, it is called super gene of the body. TP53 is a super gene of the body. If TP53 mutated, that lead to Li-Fraumeni syndrome. Family members with this syndrome have increased risk of several type of cancers. So we can't conclude by an individual cancer type. That's why we have to focus whether this person, this cancer patient, having any family history or not. That is what the main thing. So because of all the cells have TP53 change, the change in TP53 also very common in cancer cells. These TP53 changes acquired during person's life. It might be inherited or it might be sporadic. So next gene we are going to see is DNA repair genes. As we have seen that oncogenes, tumor suppressor genes, and DNA repair genes. The name itself indicating if the DNA is damaged, the molecule is encoded, wrongly encoded. The gene immediately identify, no, this is not the order. This is not the sequence. So immediately it repair. It's just like repairing the car in a garbage. It is kind of a repairing, the repairer. So DNA repair gene role, the functioning of DNA repair gene, if sometimes, because see, if every single cell has to be divided into two cells, right? In every division, the whole genes have to be divided. The whole genes in the cell has to be divided into two individual, two separate things, right? So in such complex process, mistakes should be happen. So that's why there is a master, there is a teacher who vigilance the division of the cells. So if anything happens, anything mistake happens, he immediately rush. I mean, the gene immediately called for the protein to repair the damage or the sequence, the changes of the sequence of the whole gene. That is what DNA repair gene works. DNA repair is a collection of processes by which a cell identifies and corrects damage to the DNA molecule that encodes in the genome. So this DNA repair gene, when a cell divides to make new cells, it need to make a new copy of all its DNA. So a new copy of cell must be have all the copies of DNA, right? Whatever the DNA in the first single cell, master cell, that same whole amount of DNA should be divided into two different cells. So this is a complex process and sometimes result in mistakes in the DNA. So genes known as DNA repair genes act like a person who repairs a car. I already explained it. It helps to fix the mistakes in the DNA. They can't fix them. They trigger the cell to die so that mistakes can't cause any further problems. So if they can't able to fix the problem, immediately it initiates the cell to apoptosis. You die. You must die because you have a problem. The cell have a mutation. If you divide into two or three, it might lead to metastasize or it might lead to cancerous thing. Tumor form, it can form into tumor. So immediately the cell must die. It immediately initiated the cell to apoptosize. So if it can fix the problem, it will fix the problem. If it can't fix the problem, it triggers the cell to die immediately. So the mistake can't cause any further problems. So this is the main function of DNA repair genes. But sometimes it doesn't goes well. Something goes wrong with one of these DNA repair genes, it can allow more mistakes. So if the DNA repair genes has been mutated, it will allow the mistakes to build up inside the cell, and the whole process scenario has been completely changed. It will collapse the whole concept of protecting the cell, which could lead to the cell growing out of control. As with other type of gene changes in DNA repair genes can inherited from the father, inherited from the parental generation or acquired during the person's lifetime. So it might be inherited or somatic or sporadic, whatever it might be, but the change is change. So examples of DNA repair genes include BRCA1 and 2. As I said, breast cancer 1 and 2. So we have a lot spectrum of different things what we have seen. So this is a very beginning, very first class and the basics of the genes. What are the genes that cause cancer? How the process on and off mechanisms in the cancer and how the mutation will happen. These are the basic scenarios happening in the cancer portfolio. So we are dive into the next episodes, we can majorly focusing on what are hereditary factors and what are the hereditary syndromes and what are somatic thing where genetics can imply for the precise medication and the treatment. So we can see overall concepts in next episodes. But prior to that, so we have seen that DNA repair genes, that is BRCA1 and 2, these are the genes are called DNA repair genes. People who inherit a pathogenic mutation in one of these genes having higher risk of some type of cancers, particularly breast and ovarian cancers among women. So, if a person or a woman inherited a pathogenic variant of BRCA1 and 2, if their parental generations have breast cancer or ovarian cancer, then particularly the woman must go for prophylactic measures. For example, I think you people know who she is. She is Angelina Jolie. Why genetics is important in cancer? If anybody asks you as such a question, you can immediately start up with a story called the Angelina effect or a Jolie effect. You know, Angelina Jolie mother got breast cancer. And their grandmother, I mean, their superior parental generations having breast cancer history. At the time of her 43 and 44, she doesn't have any kind of changes or any kind of symptoms that preferably indicating breast cancer or a lump or a tumor, anything according to the breast cancer. But she went through BRCA testing, BRCA1 and 2. She got positive. She has a pathogenic variant in BRCA testing. Immediately, she opted for bilateral mastectomy as a prophylactic measure to prevent the cancer. So the point is, genetics, if we study the molecular level changes, if we examine the whole concept of molecular level mutations, if we know that if the gene is a pathogenic variant or it is a pathogenic or likely pathogenic or a benign variant, whatever it might be, we can have assess the treatment or preventive measure guidelines. So the change in molecular level, the change in the type, it might inherited from the grandparents or parents, or it is a sporadic or somatic one. So everything has different kind of treatment options and different kinds of pattern of treatment and management. So in the case of Angelina Jolie, she opted for bilateral mastectomy that led a revolution in America. That's CNN report, the Angelina effect, BRCA gene testing in America. Before Angelina 2013 announcement, 350 people per week they are doing for BRCA1 and 2 testing. But soon after, Angelina Jolie has done this extraordinary thing that she proudly announces to the people, yes, I done bilateral mastectomy because I want to prevent myself because BRCA1 and 2 got pathogenic variant. It will cause breast cancer in my lifetime anyhow. So we can't say that in just 5 years, in 10 years, or upcoming years, we can't assess when she will get breast cancer. But she maximum in 99.9% she will get the breast cancer. That can we can say due to a pathogenic variant we found in the BRCA testing. So Angelina Jolie done with the BRCA1 and 2 pathogenic variant, she immediately opted for bilateral mastectomy surgery. Soon after Angelina thing, so 500 BRCA testings per week has been increased 40% in 2013 itself, but now it is 13,000 BRCA testings per week has been happening in 2023 in America. So that is what we are upgrading to visualize the molecular changes, to visualize the genetics changes in cancer. So genetics have a predominant role in cancer that actually changes the whole scenario that will guide up the following treatment options and surgical options. If BRCA positive, then you should opt for mastectomy. BRCA negative, then you'll go for lumpectomy to see further changes. So as per now, the generation is so advanced, the sequencing mechanisms are greatly developed, and we have a lot of mechanisms, missions have been highly growth, and we have a human genome project is almost completed. So we have a lot of chances to visualize molecular level in any aspect. So I hope this is the basic line of genetics in cancer. We have a lot of episodes soon on. I hope the session will be helpful. Thank you so much. If you have any doubts, you can contact our Gmail. And thank you. So for the discussion, if you have any doubts, please.
Uh, Dr. Krishna Sai, First of all, thank you for such a wonderful session. Uh, I enjoyed the PPT presentations and your way of explanation. It's very nice. If any query is there, we will take for a few minutes and then we'll close. Okay.
Sure, sir. Sure.
I think we don't have any queries. And most of the students, I am very new to them. Prajwal, do you have any questions? And anybody from the class, feel free to ask any doubt you had.
I think there is no question, sir. You people learn something
Okay.
today.
Yes, yes. We
Yeah.
will wind up then. Thank you,
Yes, sir.
everybody, for joining. And Dr. Krishna Sai Reddy, once again, thank you very much for such a wonderful session. And Dr. Krishna Sai, I also would like to invite you for such uh, genetic related concepts to our students also. So one day we will plan for that.
Sure, sir.
A few concepts related to pharmacogenetics or some clinical concepts, genetic counseling, such concepts which are useful for pharma field, for clinical pharmacists. So it would be useful for our students also.